Hello, everyone. Jason Wisniewski from JW Senior Insurance coming back at you with another video today. And today's topic is going to be the 2025 Medicare cuts and changes and how that's going to send ripple effects through the Medicare market and how it may affect those of you out there, Medicare as well. So, what I want to start off with is that there are going to be uh, some funding cuts to the Medicare program, and that's going to affect all types of policyholders since the the companies that offer Medicare Advantage, Part D prescription drug coverage, dual special needs plans, and Medicare Supplement or Medigap plans are largely the same companies. So there's been a $722 million per carrier cut from the Biden Harris administration to the insurance companies that administer Medicare Advantage plans. And that is a large portion of the Medicare population, over 50%. It's a majority of my clients, but it's also going to extend to the standalone prescription drug plans for those folks that are on original Medicare, and also the Medicare supplement plans that a lot of folks on original Medicare use to supplement their Medicare A and B. Because when the insurance companies get squeezed, they pass those costs onto the consumer. They've also cut um, agent and broker compensation on a lot of the plans, especially on the Medicare standalone prescription drug plans. The premiums for standalone prescription drug plans are going to go up quite a bit. So you may see a little bit of sticker shock there on the standalone prescription drug plan increases, as well as the Medicare supplement plans. Those are going to see some unprecedented monthly premium increases as well. On the Medicare Advantage side, where there was a direct hit, you're going to see a reduction in some benefits with some carriers, largely due to the fact that some of the smaller carriers were not able to withstand the cuts and they have exited the market. Even some of the bigger carriers have had plan exits. Humana alone, half a million members' plans will be terminating, and they'll need to shop around for new coverage. Now, if you're a client of ours, we're going to reach out to you if your plan is terminating and make sure that you get a new one for 2025. But just be aware that those annual notice of changes are going out now, and termination letters are also going out now. So keep your eyes peeled for your mail. Um, I'm sorry that I have to. You may think that's political of me to call out the Biden Harris administration for those cuts, but I'm not a politician. I'm a licensed insurance broker, and no matter what administration is in, it's my job to give you the correct information. So I hope you'll appreciate that. No matter who you're going to be voting for, I have clients that are Democrats, Republicans, Independents, Libertarians, from all political walks of life. I'm just giving you the information. And my personal opinion on it, I don't think that it was right, especially when we have people coming across our border illegally and they're getting, $5,000 monthly uh, debit cards for spending. But that's a whole nother discussion for another day. Um, but as far as the Medicare plans are concerned, yes, there will be. I've seen some plans that did not have medical deductibles last year that will have them this year due to those cuts, because these cuts are not matching the inflation costs, and the plans since the end of COVID. As you know, during the 2020 year with COVID, we had where people were not going for a lot of routine care um, and testing, and they put off a lot of those appointments because of the fear mongering that was going on over COVID. And the result was the next year, Doctors and hospitals got rushed with, a lot of patients coming in for tests that they had delayed for a year, and the carriers just saw some big increases in claims that they've had to pay out. And now, instead of keeping up with those costs, the Biden-Harris administration has cut those payments to those insurers. So you're going to see some reduction in benefits. There may be, less dental, over-the-counter vision. There may be higher specialist copays on some plans. Now, that's not to say that the market is completely busted. There's still going to be quality plans. These plans are innovative, and they do plan for this, this stuff, and have contingency plans in place, and they've tried to make the benefits as good as they can. There are going to be some plans that weather the storm well, that will still have good benefits. So I'm not saying that there's going to be nothing good out there, but there's going to be a lot of disruption in the market with some plans leaving the area, and some plan costs going up. So we're going to have to be doing our due diligence and probably shopping more this year than people have in years. Rather than just kind of having it, on a coast, and you know, just staying on the same plan year to year. So um, now, that's not to say that there were no positive changes. And there's, nobody is going to be blinking an eye at the $2,000 cap on prescriptions. That's a good thing. However, it was done a little bit improperly, and it's not as good as it can be. What is happening here now? There's 10% of people that's prescription costs that are on Medicare exceed $5,000, and you get into that donut hole or coverage gap. A lot of you know what I'm talking about. So that part is going to be eliminated, which is a positive. Now there's going to be a $2,000 copay cap. But instead of putting the additional responsibility on the drug manufacturers, where it really should have been, because these are the companies that have been ripping people off with these high drug costs, they put it on the insurance carriers inexplicably. And now that the carriers have to pick up the lion's share of these costs, they're cutting benefits in other areas and raising premiums. I think that was a very stupid move. But, a lot of these politicians are in bed with big pharma, and they won't really do the right thing. So it is what it is. You're going to see some plans, in order to be paying for all those costs, they're going to cut some of the prescriptions that they covered in the past. They may force you to take generics, when the brand was the one that was working. So we're going to have to search, a lot of people will have to search for the right plan for them that's going to cover the medications that they want and need. It may not be your current carrier. So we're going to have to take a look at that this year more than ever. Um, you know, so I don't mean for this to, to sound like a Debbie Downer, but I'm not going to blow sunshine up your ass here. That is not my job. My job is to give it to you straight, so that you know what to expect on January 1st. Now, what I will say, I'm going to do some separate videos on some of these other topics. Like, there's going to be an entire video dedicated to the prescription drug coverage, because now there's going to be a new feature called the Medicare Prescription Payment Plan. Now, this is only going to be for people that have very high drug costs, that without a doubt, you're going to reach the $2,000 cap. Um, like I said, this is about 10% of people. I think 10% of people are going to benefit from this. Maybe 30% of people are going to have their overall drug costs stay the same, and maybe 60% of people might see a slight to significant increase, because the plans are going to restructure a lot of their benefits. And plans that maybe didn't have a deductible in the beginning of the year, knowing that they're going to have to cover more costs later on, they're going to put their deductibles up front. So that's going to be something that we're going to watch. But if you're one of our clients, we're going to navigate that for you and make it as painless as possible, um, as we can. And if you need our assistance, of course, you can contact us directly, 609-496-8030. We're licensed in 14 states throughout the country. We offer home appointments in New Jersey and in Eastern Pennsylvania. We also offer meetings by Zoom, email, and over the phone if we can't meet in person. Um, but definitely reach out to us. Visit our website, www.jwseniorinsurance.com. And if you live in the Burlington County, New Jersey area, we will be staffing Walmart this year. The Walmart location in Burlington on 2106 Mount Holly Road in Burlington, Monday through Friday, 10 a.m. to 5 p.m. You can stop in there. I do recommend making an appointment because appointments are filling up fast. But walk-ins are welcome. I just prefer an appointment if you want to make sure that you're, number one priority when you walk in, because I do expect it to be very busy there this year. So, um, but I just wanted to, give you guys a heads up. But we are going to be delving in to that prescription drug plan topic because for those folks that have high costs, there's going to be a feature called the Medicare Prescription Payment Plan. Now, your carrier will be reaching out to you um, during the fall. That you want to sign up before January 1st, if at all possible, to get into this, because if you have high costs, they're going to allow you to not pay at the pharmacy, but instead pay your insurance company a monthly bill. So let's say you had this very high drug cost, and it's it's a let's just go with the worst case. It's $2,000 or higher for that medication you know for even a 1 month supply. What's going to happen is if you sign up for that Medicare prescription payment plan, you're going to be able to pay that over the course of 12 months. So $166 a month would be your maximum copay in that instance. But like I said, we're going to do a completely separate video on that. That whole thing is not going to apply to you if you get extra help through Medicare for your prescriptions from Social Security. If you're on a state-specific pharmacy assistance program like PAD in New Jersey, Senior Gold in Wisconsin, wherever you are that has a special prescription assistance program, don't pay any attention to the Medicare prescription payment plan because that's not going to be recommended for you. But, like I said, if you have any questions on that, just give me a call, 609-496-8030, and we will let you guys know all about that. And just wanted to give you guys a heads up on what you're going to see. If you want a source to these cuts, there's an article I can share with you. Just send me an email, jwseniorinsurance@gmail.com. The article about the cuts, that is an article that I sourced from The Hill, if you're looking for that information. And that is, those are direct government statistics that this is taken from. So I hope this is informative for you guys about the upcoming 2025 changes overall for Medicare and how that's going to affect the market. Stay tuned and subscribe here to our YouTube channel for more updates. We're going to be coming up with very specific videos describing a lot more of this stuff, but just wanted to give you guys just a broad overview of what is coming down the pike. And thank you guys so much for tuning in, and we'll see you guys on the next one. Take care.